大家好，这次我们举办了第2届心理健康高峰会，也欢迎也接受很多的国家，17个国家，还有31个外宾来演讲。然后这次的议题呢非常非常丰富，大家这2天当中都觉得接受很多的不同的国家，还有很多的他们的做的政策啊，心理上的一个心理健康上的倡议。那我想我们接着呢，台湾也要做一些行动，还有策略，还有一个联盟。那我们要把这个行动的计划呢，要在这几年，我们也希望好好去把它落实执行。我们也跟世界各国非常骄傲说，我们台湾的心理健康最棒了。
I would like to congratulate Professor Chang and her team on the successful organization of the 2nd summit for the Gamma conference. And I look forward to attending the 3rd one next year in Canada. Since we formed ourselves as a board last year, we have come a long way, and in fact, membership has increased as well. Mental health is something that needs to be mainstream, and it cuts across all aspects of life and work. So therefore, the importance of mental health. Governments, NGOs, organizations, associations, schools, and also individuals must come forward and do their part and contribute towards the mental well-being of everyone in society. All of us have our part to play. So therefore, in October, as we celebrate Mental Health Week and month, I hope that all of us can give some time to reflect and think about the importance of mental health and also how it is going to see us forward into the future. For example, in many countries, including Singapore and Taiwan, we have an aging society. So therefore, again, in looking at mental health issues and mental well-being, we have to tweak it accordingly to make sure that we address issues such as dementia, active aging, and so on. Similarly, across the board, where there are younger populations in developing countries who are also members of Gamma, we hope that they will tweak this accordingly and customize to their setting. And I hope that with this global movement, we can make sure that all advocates are represented and also the awareness for mental well-being is much more widespread. Thank you very much.
Hello, my name is Dr. Lilian Comas Diaz. I'm a clinical psychologist. But I think as a clinical psychologist, I'm a person that is interested in people, in all aspects of people. Mental health is part of people's life, but I would like to say that mental health is actually health, because the mind is the most important organ in our body. So the mind really manages our physical health. So that's one of the reasons why I'm interested in psychology, because psychology embraces multiple aspects of people's life. I live and work in Washington, D.C., so I work with a lot of people who are either people of color, by that I mean African American, Latinos, Asian Americans, indigenous, mixed race people, people who have not been in the past served well for mental health, because a lot of the models that we had of treatment of mental health were basically founded in studies of white individuals, mainly men, and mainly college students. So my work is around being culturally competent, bringing into the treatment the context of people's lives. I work a lot with women, and I also work with marginalized groups such as lesbian, gays, bisexual, transgender, and queer people, whose context is just primordial in their life. So understanding people in their context is paramount to being able to work effectively in their mental health. I also am a big believer that we as clinicians, we also need to be advocates and to promote mental health or health in general, and that there are different ways of doing that. One is in the room, in the therapy room, but also being a social justice activist, which I am, And I mean by that is that we work to change policies, to change laws, to actually make transformative changes in society so everyone can be treated with equality, respect, and justice. So I see that as part of mental health. I also work in delivering what we call psychology to the public. And that means like being in this conference, but also means using some media to educate or share with people that if they're suffering from mental health problems, they're not alone, that there's help, that there are adaptive and maladaptive ways of coping with psychological problems, and that many times problems in living, whether they're severe, chronic, or even normal, are part of life, and that by infusing and helping people to develop resilience, personal, family, group, and collective resilience is a way of addressing multiple aspects of health. So as you can see, I'm optimist. I believe that things can be reframed positively as a psychologist. And what I tell my patients or my clients is that I'm in the business of hope when they come to see me. So I hope that you also be interested in promoting hope, whether you suffer from some psychological problems or health problems or any kind of problems, that there's hope, and the issue is how to get there. And I hope that you can find your way there. Thank you very much.
Hello, my name is Dr. Frederick Jacobson. I'm a clinical professor at the George Washington University School of Medicine, and I have also a private practice, which is different than most psychiatrists in that it involves some parts of neurology, sleep medicine, and behavioral neurology, neuropsychiatry, as well as geriatric psychiatry and regular psychiatry. But a major emphasis also has to do with public health. Much of my interest in practice has to do with the treatment of depression and bipolar illness. And for the last 35 years, I've been actively involved in supporting the National Depressive Bipolar Support Alliance in the United States, which is the country's largest self-help group, and it's exclusively devoted towards those individuals who suffer from affective illness, mainly depression and bipolar illness. In this service, I am a great believer in, because I also have a degree in public health, the power of prevention, that is, implementing strategies and practices which can help prevent illness from developing and illnesses from worsening. For example, people that suffer from depression, particularly after age 50, are significantly greater risk of developing strokes, heart attacks, and eventually Alzheimer's disease. So it is critically important to make an accurate diagnosis of a type of depressive illness so that one can prevent these kind of future illnesses. We now know that there are a variety of medical illnesses which contribute to or directly cause depression. For that reason, I'm interested in things like sleep medicine, because I diagnose a lot of people with having certain sleep disorders, such as sleep apnea, which can cause not only depressive illness, but contribute to cognitive dysfunction. So I think it is incumbent and important on all mental health professionals to bear in mind that there can be physical contributions that are behind the symptomatic complaints of depressive and anxiety symptoms and even disorders of their thinking. It's extremely important then for mental health professionals not to disregard the potential physical causes that may be adding in to the presentation of the individual. And this is where the public health really comes into play. In this conference, we've had a big role in patient advocacy, particularly for the elderly. And I think there have been many good presentations which have found that taking a look at the problems faced by elderly cross-culturally in different countries that are represented in this conference have somewhat different manifestations and different sets of problems, but that there need to be certain unified solutions that can cross government lines. And sharing the information, as we've done in this conference, I think is very relevant to helping healthcare professionals with this kind of work for mental health in the future. Thank you very much.
Hi, I'm Dr. Priyanto Jatmiko, psychiatrist from Indonesia. I have mentioned and I support to mental health promotion by develop the coordination, cooperation, and work together for the multi-sectoral component and also for any organizational anywhere, so we can share each other for the information, and we share about how to train each other, and we share about methods to promote the mental health solution, not only for our country but for everywhere, and for any nations. In this, we can go through together. That's the point. I really appreciate for this global summit. Thank you very much.
Hi, I'm Dr. Lee Seow Hwa. I'm from Hong Kong, and I'm very glad to be invited here to come to the second summit. I gave a talk this morning, and it's very well received. Sunday here in Taipei. My passion, my interest is in mental health promotion, and what I did in Hong Kong, I was in the field of old age psychiatry, and I feel very strongly that something should be done on old people. In Hong Kong, I suppose in Taiwan, Taipei as well, the whole population is getting older. What I heard from other speakers is that there's low birth rate. People in Taiwan don't want to have children, and so people are getting older. So the burden of old people is getting heavier and heavier to the whole society. What I want to appeal to Taiwan people, Taiwan government, is to really look into this matter in a very concerted and very severe manner, and to put funding into this field so that the mental health of the old people are being looked after. So what are the mental health issues for the old people? Basically, there are 3 or 4. Top on the list is dementias. Various types of dementias. Basically, we have degenerative dementias, or otherwise called Alzheimer's disease. And we also have vascular dementias, and we have other types of dementias. So the vascular dementias in particular are preventable. So I think and I suggest to the Taiwan government to do something on the prevention of dementias, concentrating on the factors leading to vascular dementias. And secondly, the trick about dementias is actually early treatment, early interventions. So to do this, we must have early detection, early diagnosis. So a lot of educations, a lot of coordinations must be provided to the general practitioners and to the social welfare services so that old people with dementias are being picked up early and referred to the appropriate doctors quickly. And therefore, treatment can be started early. And if treatment can be started early, then the results are much better than if treatments are started way later. So this is the first thing I suggest or I appeal to the Taiwan government to do. The second problem a lot of old people, actually in Hong Kong as well, have is depressions. They will have depressed mood, last very long time. A lot of them actually to do with losses. For example, if the spouse, for example, man, their wife died, so they have bereavements. They will feel sad about passing away of their wives. But some of them actually it has prolonged or abnormal bereavements, and that leads to depressions. Or some of them lost a job a little bit too early, or some of them lost other things. So physical illness coming in, strokes, for example. So a lot of our old people have depressions. And depressions or depressive illness are very, very treatable. So we have to do things on this illness as well. So depression is another thing I would urge Taiwan government to look into it very severely and also do something. Then there are other problems relating to old people, but my time for interview is about up, so I will stop here. Thank you very much.
Hello, my name is Cheryl Tyeska, and I am an independent consultant working in crisis response and death and dying training. I'm here at this conference to actually help promote the idea of community-based crisis response teams and to talk a lot about collaborating and building collaborative networks. I have been working with victims of violent crime and disaster for about 35 years now. I've worked with just about every kind of victim you can imagine, from car crashes, plane crashes, hurricanes, fires, acts of terrorism, wars, you name it. And one of the things that I really would like to promote is the idea that crisis intervention and disaster mental health services really starts with the local community. And I believe that crisis intervention can be provided even by paraprofessionals or non-mental health professionals, and that those people can be the eyes and ears of the community. They can get information to the mental health professionals about where the help is needed the most, and they can be sort of a first line of defense so that they can help provide a little bit of sense of safety and security for the victims and survivors. And then if they see reactions that are outside the range of normal reactions to crisis, they can help get those referrals started to the mental health service providers. And I'm also really, really focused on two other issues. One is this issue of the need for building effective collaborations. I've been in many, many, many communities around the world where the local coalitions of service providers were very effective, but most of the places I've been to, they were not. The caregivers themselves in the community are impacted by the disaster, and a lot of times the collaborations that they've built up are themselves damaged because of the social fabric being torn apart in the disaster. So I really want to focus on the idea of creating coalitions of voluntary organizations that are active in the aftermath of disaster, and connecting those coalitions with the government agencies, with the professional service providers, and also with trainers. I'm very focused on educating community members about how to do basic benign crisis intervention. And my last focus is that I spend a lot of my time training and educating people about culturally appropriate ways of talking about death and dying. It's something that a lot of people and a lot of cultures find very, very difficult to deal with in a very straightforward way. But oftentimes in the aftermath of a disaster, when there has been a lot of death, having somebody or some people who are able to talk about it openly makes it possible for the rest of the community to feel more comfortable doing that themselves. So those are the things that I like to focus on, and I really have enjoyed my opportunity here to meet with other people who are focusing on mental health promotion.
Hi, I'm Porsche from Silver Ribbon, Singapore. I'd like to give thanks to Professor Chang and the team from Mental Health Association in Taiwan for hosting us and providing this great platform for everyone to share the ideas and network. I'm truly thankful. Thank you for your hospitality. Thank you so much. Thank you.